There are a variety of reasons why people can't pass urine and need a catheter to drain their bladder on a short or long-term basis. A catheter is a narrow tube inserted into the urinary tract and bladder to drain urine. A small balloon at the catheter tip is inflated with water to hold it in place. As urine fills your bladder, it drains down the catheter into the bag, so you won't need to wee while it's in place. In fact, you may feel immediate relief as any blockage is released. The urine drains from your catheter into a leg bag secured with 2 straps. The longer upper strap forms a figure of 8 around the back of the knee, while the shorter strap fixes the bottom of the bag to your leg for maximum support. Make sure the straps are threaded through the back of the bag to keep it out of the way of the valve. It's important that the bag is secured to stop the catheter from pulling, which could lead to trauma or infection. A retaining strap provides additional support to the catheter tubing. Overnight, attach your leg bag to a 2-litre capacity night drainage bag, supported by a floor-standing hanger, so that the urine flows freely and you can sleep better. There are 2 kinds of night bag. The non-drainable bags are used once and disposed of. The drainable bags are emptied into the loo and can be reused over a week. Alternatively, you may be given a catheter valve rather than a bag. This is attached to the end of your catheter, so you can drain urine directly from the catheter into the loo. The valve needs to be changed weekly. Always wash your hands with warm soapy water and dry them before you begin. Simply open the bottom tap so that the urine can drain into the loo. Don't forget to close the tap afterwards and wash your hands again. Although your catheter can be left in place for up to 3 months, the bag should be changed every week. After washing your hands, pinch the catheter off the connector, making sure you don't touch the ends of any connecting tube. Remove the drainage bag tubing from the catheter, twisting the bag connector gently as you do so. Take the protective cap off the new bag and immediately insert the drainage bag tube into the catheter. Use this cap to stop the old bag from spilling. Secure the new bag in place. And finally, empty the old bag into the loo or receptacle before disposing of it. If urine does not begin to flow freely into the bag, contact your healthcare professional for further advice. The most common problem faced by catheter wearers is urinary tract infection, caused by bacteria entering the bladder from the catheter or the area around it. So hygiene is all important. Always wash and dry your hands with soap and water before handling any part of your catheter or drainage system. If possible, take a bath or shower every day, leaving your drainage system in place. Wash the catheter using downward strokes away from the body, and then wash the area where the catheter enters the body with soap and water only. This should be done every day, both morning and night, and if possible, after opening your bowels. If there is discharge from where the catheter enters the body, you can cleanse more frequently. If the discharge is discoloured or smells, contact your healthcare professional, as this may be a sign of infection. Men who are uncircumcised should pay particular attention to washing under the foreskin and should use a separate washcloth for this part of the body. After washing, return the foreskin to its usual position. Women should always wash from front to back in order to prevent contamination from the area around the anus. Your catheter should remain comfortable and pain-free. If you experience any discomfort, discharge, or if urine runs outside of the catheter, consult your healthcare professional. Make sure you have a spare catheter and all the necessary equipment needed at home to renew your catheter. When your catheter is changed, get your catheter passport updated. Drink at least 2 litres of water or fluids each day. Eat a well-balanced, high-fibre diet to prevent constipation, as this can cause your catheter to leak and increase the risk of urinary tract infection. Keep as active as you can. Having a catheter shouldn't prevent you from having a full social life or from going away on holiday. Alternate your leg bag position from one leg to the other regularly, if comfortable. If at any time you experience lower abdominal pain or back pain, unpleasant smelling, discoloured or blood-stained urine, or fever-type symptoms, you may have an infection and may be asked to submit a urine sample for testing. And if your catheter falls out, contact your healthcare professional to get it replaced, or for any other advice and support on how to manage your catheter.